From the Skyterra Wellness Retreat, this is the Inspired Intentions Podcast, where we help people build the skills and mindset to live a healthy life. This presentation is for educational purposes only and is not intended to provide any medical advice. The presenter will not evaluate, diagnose, provide any prognosis, care, treatment, or care treatment plan, nor any advice, opinion, or consultation regarding any of the foregoing for any attendee. This presentation is not suitable for obtaining medical care for your treating medical provider.
Welcome back, Inspired Intentions listeners. Our topic today is intravenous micronutrient infusions, and who better to break that down for us than Dr. Teresa Campanile. Hi, Dr. Campanile.
Hi, good morning.
Good morning. Welcome back to the show.
Thank you.
And you and I have a story.
Yeah.
And it involved a coworker, and I was on Google Meet, so I was kind of seeing this, just kind of watching everything on a screen. But one of my coworkers here at Skyterra wanted an infusion during a meeting.
Mm-hmm. I remember that very well.
You kind of rolled in the equipment, got her all set up, and then she just got the infusion during the meeting.
That's right. Well, and we do a pretty good job taking care of each other here, and it all felt pretty comfortable and normal, and y'all weren't thrown off by it at all, but what we hadn't planned for, I do remember during that meeting, it was just a very active meeting, and she was moving her arm around, so the infusion
and she speaks with her hands anyhow, yes.
Yes. That infusion took a little longer than expected because of that, and when that meeting ended, the next one was a new interview with an employee that we were meeting for the first time.
Yes.
We were meeting Ryan for the first time.
Yes,
dearly
our fitness
beloved
director. Yes.
Ryan. So shout out to Ryan, who handled the world's weirdest first interview.
Yes, because that infusion went on through his through his interview, he was unflappable. He was like, "Oh, okay, that's what we're doing." And I must say, I was like, "What is going on?" But anyhow, yes, we do a good job of taking care of our staff and our guests, of course. So that's what we're talking about today is IV micronutrient therapy. And I guess we should always just start with, what is it? What is IV micronutrient therapy?
Yeah, so intravenous micronutrient therapy is not new to the scene. It's been popularized and is more known about, and we kind of understand what it's doing a little bit more, but it's actually quite an old therapy. The word micronutrient refers to nutrients that we do need, but in much smaller quantities than our macronutrients. So macronutrients are proteins, fats, and carbs, things that we need in like kitchen scale amounts every day. And, that's critical enough that when that balance is off, it's not subtle. Within days, weeks, months, your body's going to notice. Micronutrients are nutrients that are not available in the same way. They're not things that we'll necessarily have access to day in and day out. And our bodies are very well designed to extract them when we encounter them and recycle them and hang on to them until the next hunt or the next summer when we encounter that nutrient again. So micronutrients are a little bit more stealth in the sense that, because we're designed to go long periods without them and hold on to what we have, when we do become deficient in them, there's also our bodies are trying to work around that, wondering, okay, we're running a little low on, say, magnesium or zinc, and we're going to share what we have and find a way to use the magnesium that we do have and send it across and share it between different organs. So there's a little bit more guardedness physiologically in trying to adapt to that nutrient as we're running out of it. What that means in real life terms is that macronutrients, that balance being off will make your body change quickly and obviously, whereas micronutrients, when we are running low on something, it tends to come out slowly over time, months, years, and it's not just one organ that notices. So it's multi-system disease that manifests as a result of micronutrient deficiency. So there are vitamins and minerals that are both micronutrients, things that we are exposed to in small amounts and hold on to. So those include certain B vitamins. Those include zinc, magnesium, copper, and a host of other trace minerals and vitamins. So this is not something we thought much about until the industrial era, where we changed the way we make food, and we don't necessarily abide by the seasonality of the year, and we don't necessarily get access to these nutrients every winter and these every summer. You'll read about the Cherokees who would travel Mountain to Sea Trail every year just to, for certain ritual purposes, but also to access the nutrients in the ocean every year. So we're living in an age where there are very strong connections between most of our chronic comorbidities and micronutrient deficiencies. So have been very proven and demonstrable links between cardiovascular disease, whether that's high blood pressure, strokes, heart attacks, and micronutrient deficiencies, and whether it's low magnesium, low vitamin C levels. And it's a bit of a chicken or egg story, but we know that that's true. People who have cardiovascular disease have lower levels of serum vitamin C, have lower levels of intracellular magnesium. Magnesium lives in the cell, so that's how we have to measure it. So that link is there, and then correcting that's kind of the world that we're in right now. Is it a cause or a consequence of it? And to some degree, maybe that doesn't even matter, because we have shown, and most of the studies were done with oral repletion, but even repleting magnesium has been shown to reduce that blood pressure. Replacing vitamin C can reduce blood pressure to a different degree. So we both know that the lack of micronutrients is associated with those diseases, either because maybe the micronutrient deficiency led to the disease in the first place, or the disease process just burned through that nutrient. But one way or the other, we know that replacing it does show pretty obvious clinical benefit. So now we enter the realm of, we've recognized that there's and this connection does not just exist for cardiovascular disease. Diabetes, highly linked to your availability of zinc and chromium and magnesium that help to facilitate the insulin receptor interaction. All of the fatigue syndromes, the ones that we don't really understand, chronic fatigue, fibromyalgia, those are conditions that over and over show us there's a link between micronutrient deficiency and the condition. Again, the argument of, is it a cause or effect? We don't know, but we're still trying to figure that out. If you look back in history, though, even before we were able to understand these mechanisms, Dr. Myers was a doctor who he became a doctor in the 40s. So imagine at that time we were not thinking about pathways this way. He was a medical doctor, opened up an alternative clinic in Baltimore, and in the 70s, his claim to fame was he treated a wide variety of chronic conditions with a cocktail of micronutrients that most cells need, or that he suspected were depleted in chronic conditions. And he had great results. The clusters of diseases that he treated. And by the way, he passed in the mid-'80s and had multiple predecessors who took on his work and continued to treat people. When his clinic closed, there was a very strong uproar to people who really kind of started to decline after they stopped getting these, their protocol. And the medical world had not totally bought into this therapy yet. So there were people who basically stepped up to continuing his lineage. those people who adopted his practice were very loud about publishing their findings. They recognized that what Dr. Myers did wrong is he treated a lot of people. They all said they felt better, but he didn't do, he didn't publish his findings and release a lot of his private documentation around what his recipes were and how he adapted them. So the next era did a lot of work in that. You will find lots of physicians who over time, the Myers cocktail, and it has been modified by different practitioners in some ways, adding a little bit of this, a little bit of that, and we'll kind of get into what's really in a Myers cocktail. But the people who took this on, maybe adapted it a little bit, did a great job of getting the word out on what these can do for chronic conditions. These have been presented at countless medical conferences. Because of the nature of these are just vitamins, no pharmaceutical company owns them. The research behind probably will never get the large randomized controlled trials over something that's been that can't be patented, and the amount of money that would have to go into to studying something on that scale may never come to us. But honestly, over decades, we have enough practitioners communicating the benefits that they've seen in patients around these that we kind of know where they work and for what. So what we've noticed is that micronutrients the micronutrients in a Myers cocktail, which include a bunch of B vitamins, vitamin B1, 2, 3, 5, 6, 12, some basic minerals, magnesium and calcium, occasionally zinc, and some vitamin C as an antioxidant. That's the basic. And then people add on extra antioxidants, other glutathione, amino acids for different metabolic processes. So these can be tailored and modified. But the core of a Myers cocktail are really just the nutrients that every cell in the body needs, and you can run low in a chronic condition. So the chronic conditions that we noticeably see an effect in, they cluster truly into the chronic fatigue, chronic pain, chronic migraine, an exhausted, painful body. Also, the musculoskeletal, arthritis, muscle spasms, those respond really well to this. Our musculoskeletal system is made up, the fabric of those is very mineral-based. Mood disorders, so irritability, depression, anxiety, and then lastly, immune stuff. So allergies, chronic allergies, chronic autoimmune diseases, even not even just chronic in that situation, even an acute asthma attack or an acute viral illness, there's very strong evidence of, even in the hospital, we use IV magnesium to shut down an acute asthma attack all the time. So that's a sampling of other things that are within the Myers cocktail. So those are kind of the categories of what we've noticed have responded to micronutrient repletion. So to get back to your original question, Rachel, intravenous micronutrient therapy is just the idea of taking chronic diseases that we know are linked to depletions and giving those nutrients back. We should probably talk about there's more than one way to get those nutrients back. The original way is through food. I like to just acknowledge that this is not the only way to get nutrients back. The benefit of getting nutrients IV is that it's a much higher serum concentration than what you can get through oral repletion. So for some nutrients, maybe that matters, and for others, maybe it does not. But for example, vitamin C, there's only so much your gut will accept into the bloodstream at a time. And maybe that's okay, right? Just a little bit here and there and you slowly replete. The thing is vitamin C, we have found, has different actions depending on its serum concentration. So low serum concentrations of vitamin C are good for, it's food for the white blood cells, for the immune system. It's an energizing. High doses of vitamin C actually, the body converts into peroxide and actually has a little bit more of a detoxification effect. The body, by changing by converting vitamin C to peroxide, it almost it can trigger senescence and attack cells that are kind of old, need to be cleared. Viruses, bacteria that don't belong in our bodies. Our bodies use peroxide to clear things that it wants to get rid of. So different serum concentrations of vitamin C have different actions. So that's a situation where if we wanted that peroxide effect, I don't think there's any dose of oral vitamin C that can achieve that serological dose. So there are nutrients where it matters how the concentration in your blood, how high the concentration in your bloodstream gets, and that can trigger a reaction in your body. So IV nutrients tend to come into play when we either want a high dose or a high serum concentration and we know we can't get that through the gut, or when somebody has a condition that is very likely linked to micronutrient deficiency and we can't trust their gut to get it in. So, Rachel, we have we had another podcast together on gut health and how to restore that. And, reflecting on that conversation, you can see that it might take time, work, new pattern retraining. It's kind of a big project. So it's not uncommon for people to need micronutrient repletion faster than they can achieve it through natural processes. So IV nutrient therapy, yes, I am glad it's around, and it helps certainly with a subgroup of people who really need quick access to IV nutrients.
And your office, the area where you do the IV infusions is just beautiful. It's set up beautifully. There's comfy couches and chairs, and it overlooks the mountains and Skyterra's campus and the trees, and it's just beautiful. It's a lovely place to get an infusion, much better than in a conference room during a meeting, I think. The Myers cocktail, which is the grandfather where all of this started, has that been tweaked at all?
Yeah, well, and thank you for partnering with me because, your clients are coming to Skyterra to achieve rapid results, and that blends well with one of the services I offer at my office, which is I do offer IV infusions for clients who want rapid access to micronutrient infusions. So when your clients come to me from Skyterra, often they are, yes, they want quick results. They have this is a high personal investment time, and I think that IV infusions tend to match up well with what many of your clients are coming here to do. So I have a few modified Myers cocktails that are kind of blanket offerings, very similar to what you might get at a med spa. So there are Myers cocktails slightly modified for different symptoms, and that's kind of code for low doses of those elements we just talked about, those nutrients that we have seen are helpful, and low doses enough that most people can walk in off the street and try one. They are not doses that would theoretically put you at any risk unless you have a certain medical condition. You're being screened for that at the door, though. Anybody who has heart failure or advanced kidney disease, a rare genetic disorder where you can't get IV nutrients, those would preclude some people. But by and large, most people can get a Myers cocktail or a modified Myers cocktail and monitor their own response to it. That, I think, is the hard part. So knowing if you have a response to it, some people will have a noticeable change in their energy after a singular infusion. And other people with chronic conditions will really see the benefit, a sustained benefit, come out after multiple IV infusions. So it's not uncommon to see prescriptions between 4 to maybe 12 infusions clustered in a month or two for a very chronic and when you have the suspicion of a highly depleted nutritional system. So that is the part where I feel I come in the most for my patients, is helping them gauge how much they should take on and whether, beyond just kind of those standardized recipes? Is there something that their body needs more than the average person? So those would be reasons that a Skyterra guest might choose to come see me for a formal consultation where we can talk about what their chronic symptoms are. Should they just try a regular Myers cocktail or a modified Myers cocktail, one of the ones that have already been kind of compounded, and over a series of infusions expect them to feel better? Or is there something like in liver disease and high cholesterol, high doses of vitamin B5 have been really known to help support that liver and clear out extra cholesterol and really detoxify a lot of things. So occasionally what I'm doing with patients who want to work intimately with me to kind of customize this is, I might even measure their nutrient profiles to individualize them, or customize these infusions so that we can really tailor it to their condition and then reassess in a month or two if they're having a response.
And then if this is something that you're interested in, how do you approach it with your physician?
Yeah, well, the first thing I would say is that when you should this should come onto your radar if you have one of those chronic conditions that, well, all the ones I described, the chronic fatigue, chronic pain syndromes, the chronic allergy and autoimmune systems, the immune systems that are getting tired out, the physical musculoskeletal body getting tired out. I think the time to even think about micronutrient infusions is when you kind of feel like you're in that box of, I have a condition that honestly the medical world doesn't really understand very well, and I've kind of tried what they have to offer. Most of those conditions are very frustrating to live with. They'll try fibromyalgia, they'll try every pain medication in the world, and none of them really work. So I think you can feel when you have a condition that is coming up on the limits of what current medicine understands about them. And certainly when the offerings of what to do next have kind of halted in that visit. So I think the right time to think about this is when you're not getting much progress, and you just want to see, you have a chronic condition, your body is tired and is actively trying to correct a process. And it must be at lack of something. That is a common story for chronic conditions. And when you're out of ideas, why not talk to your doctor about, hey, listen, I don't know how you feel about this, but I want to try some micronutrient infusions to see with more nutrients. Can my body do a better job of fixing this than what we're doing right now?
Yeah.
And what you're likely to come up against is, again, because this is not really well studied in the medical world, there might be a little discomfort around bringing that up. But the truth is, what you want to ask from your doctor is, what's the risk in there for me? Mm-hmm. I'm willing to accept that maybe this won't help, but there's a lot of people in history who say that it might and it could. And I'm willing to put the investment into seeing if the dial starts to move for me after doing something a little bit more aggressive but not dangerous for me in a month or two. And that not dangerous piece, I think, is what you need help from your physician with. Your physician knows how to worry about your body on your behalf. And, if they know that you're about to go embark on an IV infusion protocol, they might be inclined to say things like, well, with your kidney disease, I would want you watching this lab number every month on there. Or this really makes me nervous. You're somebody who makes kidney stones and vitamin C. So if they make that connection, but just know that there's workarounds for that too, and we do adjust doses for people with all different kinds of comorbidities. But I would use your physician to basically help to reassure yourself that this is a safe experiment to take on with your own body. They know how to worry on your behalf really well, and they know the status of your organs and what they can handle.
And do most physicians have access to these infusions, or would you need to go someplace else to get them once you've cleared it with your doctor?
No, because this has not been well studied and is not FDA approved in the standard medical world, you're not likely to encounter this in a standard primary care visit. However, I will say that there is a growing body of representation. Large organizations of physicians are speaking to the utility of these treatments. So I am a medical doctor, but I've also been trained in alternative therapies, and searching for a doctor like that might help kind of bridge those two worlds. If you go to your primary care doctor and they're not comfortable with this, and you're really just sussing them out for, is it safe for me to go to my local med spa and try this for a couple months? If you need a kind of a more complicated assessment, I think it's worth sussing out a physician who is duly trained. And the organizations that train doctors like me, American College for Advancement of Medicine, for example, you can go to their website. They have a zip code finder. Look for other doctors who have been trained. Institute of Functional Medicine, ifm.org. American Association of Naturopathic Physicians, American Holistic Medical Association. These are all organizations that are training physicians or practitioners. And so within those organizations, you can usually go to their website and link up with somebody close to you who can help you work through this.
Or you could come to Skyterra.
Yes, I am right next door. If you are at Skyterra and you're looking for guidance on this, please come over and see me.
Yes.
This is it's very exciting for me to be a part of people's care at a time when they're taking on big health initiatives. I want to help you anchor it and make sure you get what you want.
Thank you so much, Dr. Campanile. It just always comes across so clearly, just what you just said, how much you want to help people and how passionate you are about making sure that people are taking care of their bodies in a really healthful and sustainable way.
Yes, to your health.
To your health. Thank you so much.
You're welcome.
Bye, everybody. The Inspired Intentions podcast is a production of Skyterra Wellness Retreat. Special thanks to our executive producer, Alan Broyhill. Send us your questions and comments to inspiredintentions@skyterrawellness.com. Subscribe on iTunes and everywhere podcasts can be found. If someone you know might benefit from this podcast, share Inspired Intentions with them and give us a 5-star rating. Join us next week as we cut through the unrealistic noise on diets and fitness and show you how healthy living fits seamlessly into your already busy life. Thanks for listening.